Welcome back. AI can answer questions, but can it compare your doctors and your drugs? Got Presley Beaulieu here with Market Medical Insurance. You guys just changed your name. I got to remember that new name is here. Presley, good to see you,
Good,
Presley.
good to be here, Matt.
You know, we're chatting here at the break. There's a lot of different changes going on in the world, and some people are aware of them, and some people are becoming aware of them. But one thing I wanted to talk about this week with you is I wanted to figure out where is it helpful and where is it harmful here as far as regards to picking your health insurance in retirement. Start off with where it's helpful.
So, it can be helpful with more basic definitions. A lot of people come to us and are confused about Medicare parts A, B, C, D, G, N. So, AI can be pretty helpful when it comes to the more basic definitions as well as more broad comparisons. Um, Oftentimes, it can be harmful with missing important network details. That's one of the most important things we look at when we're comparing plans, as well as out of pocket maximums and IRMA interactions. IRMA stands for the income related monthly adjustment amount, that's calculated off of your tax return from 2 years prior.
And that Irma is like, or I liked how you said it better. Or Irma, Irma,
IRMA.
Irma. Oh, all right, I kind of like your pronunciation. But maybe we've been pronouncing it wrong the whole
How are
time.
you saying it?
I call it Irma, but
IRMA, okay.
Irma.
IRMA, that's how I say it.
Well, Irma sounds like my aunt. It's like sounds like some a family relative. Anyway, so common mistakes you guys are seeing people make is that it's not knowing what questions it really should be asking the retiree. It's really not. We're just like with Gerald. We were talking before the break. It's only as good as you prompt it, and if you don't know how to prompt it, how do you know what you don't know?
Exactly. You don't know what you don't know. A lot of common mistakes that we're seeing is plans excluding a primary care doctor or key specialists that our clients are seeing. And a lot of folks would rather change their plan rather than change their doctor.
Sure. Yeah. I've been going to my same doctor forever. I don't know that I want to change a new doctor. I want to make sure that's covered. And I know that's what you guys do every year during open enrollment or when you're walking someone through for the first time enrolling in Medicare. You guys walk them through, well, what prescription drugs are you taking? What doctors are you seeing? What do you got going on? And it's very thorough. And then you guys you can speak to your experience in it, where AI is just searching the internet and everything you read on the internet's true, right?
Exactly. I
So,
always say that.
it really invites sometimes potential disaster, but I think you nailed it earlier. Where AI is helpful, it helps it helps you understand a concept. You can ask questions. It's not just like a search anymore on the internet as far as, hey, what do I not know that I need to know? Because that still doesn't work. But using AI helps people understand things. I mean, I use AI to help write this show. It helps communicate. But the thing is, the disasters live in the 20% because it doesn't get you all the way there. And like you mentioned, Irma, those surprise taxes that I call them, for people that have saved really well in retirement, over 2 million bucks, they're going to have these higher taxes, high Irma issues down the road. And AI is probably not telling them that like we do when we work together as a team. So let's discuss what's the advantage when you have an advisor helping you walk through this process of enrolling in Medicare or making sure you're on the right plan.
Well, like you just said, very importantly, we go over the IRMA charges. And like you said, when you don't know, you don't know. If you're not prompting AI about that and talking about how much money you made 2 years prior, AI would have no idea to even bring that up to you. When you come see us, we do annual reviews with every single one of our clients. We review whether you are on Advantage or a prescription drug plan. We go into depth with your medication list. We give you accurate quotes as to what you can look forward to spending the following year on your prescriptions. Here at Market Advisory Group, we also have the coordination with the tax specialists, the financial planning, estate planning, to help you avoid any penalties or gaps.
Yeah, I mean, I was just going to say, oftentimes you guys come down and coordinate with me and say, someone is paying a lot in taxes here. And we normally have to then bring in a CPA and we get down to the root of it. And sometimes it's their investment accounts that's doing it.